Hi, ladies and gentlemen. This is Dr. Novoa. I received a question asking, well, it was broken up into multiple parts, but it had to do with how long is it okay to have intercourse when I'm pregnant, and when can I resume intercourse after I deliver? That was question number one. Another patient sent me a question, or another person sent me a question asking, how long do I have to wait after having had a hysterectomy before I can resume having intercourse? So let's take the second question first because it's the easier to answer. Uh, when it has to do with a surgical procedure involving the cervix or involving the uterus, it is best to wait at least, if the cervix is still present, best to wait at least 2 to 4 weeks before attempting intercourse. And if the cervix is not present, or if you've had a delivery or cesarean section or hysterectomy, it's best to wait at least 4 weeks before attempting intercourse. Now, the reason that, and specifically with hysterectomies, the reason that you have to wait for at least 4 to 6 weeks is that you have sutures. You don't see the sutures, but there are sutures inside of the vagina that are up at the top of the vagina that have closed it off. And if you start having intercourse, you're going to start stretching that area out. You're going to start breaking sutures, and you can actually open up the vagina at the top, which causes a significant amount of discomfort, actually maybe even a significant amount of release of blood, and that's going to scare everybody, but also it can be something that requires another surgical procedure to correct for. So although you may want to have intercourse, and it's hard to wait, you should wait at least 4 to 6 weeks before having intercourse when it has to do with a total hysterectomy. And if you've had a DNC or another surgical procedure, you should consider waiting at least 2 to 4 weeks. If you've had a vaginal delivery, the recommendation again is 4 to 6 weeks. And the reason for that is that after the delivery of the baby, the cervix is still open, and the internal structures of the uterus, the uterine lining, is still very sensitive and soft and engorged with tissue. And so if you have an open space, you can actually get an infection from trying to have intercourse too early. And so you should wait at least 4 to 6 weeks related to that. Also, if you've had any lacerations which your doctor has repaired, you can start popping those sutures if you haven't waited the full time that's at least 4 to 6 weeks. And so most doctors will see their patients on follow-up approximately 2 to 4 weeks after the delivery. And so you can ask your doctor at that time, how long should I wait? And the doctor will know better than anyone, because the doctor will be able to tell you if he or she put any sutures in the vagina or any repairs, and how you were repaired, and that's going to give you more information as to when it is safe to go ahead and have intercourse. Now, as far as pregnancy is concerned, the number one question from dads has always been, how long do we have to wait before having normal sex, or can we still have sex while she's pregnant? And the key to this is to take the one answer that I generally give for patients is that as long as she's comfortable, then it's okay to have intercourse, unless there's a specific reason, a medical reason, such as a placenta previa, which you can have intercourse. But if she's comfortable and it's not causing her any pain, then it's okay for you, the couple, to have intercourse all the way up until the time that her water breaks. And the reason that you have to stop when the water breaks is because now you actually have a communication between the uterus and the vagina, and basically the patient is in labor, and so you can't have intercourse after the water breaks. But prior to that, as long as she's comfortable, then basically it's okay to have intercourse. But of course, you're going to need to discuss this with your doctor again to make sure that there's no medical reasons why you can't have intercourse. Another point is that patients will notice that if they're having intercourse when they're pregnant, that there's going to be times when they start feeling contractions, especially after he's had his orgasm, and if there's any stimulation of the nipples, and you're going to have these contractions that occur. Now, these are temporary contractions and not strong enough to actually put you into labor under normal circumstances. And so it's okay to notice these changes, these contractions, after having intercourse. And as long as there's not a medical problem, which again you need to ask your doctor about, it's okay to continue to have intercourse right up until the time that water breaks, even if you're noticing contractions related to while you're having intercourse. So I hope this answers the question related to the sex question, because it is the most common question asked by fathers-to-be, and the most common question asked by patients that have had hysterectomies. So if you have any other questions, feel free to send me a question by email or on Facebook. I'll be glad to answer them. Thank you.